Now let's take a look at strokes. Strokes differentiate from heart attacks because the blockage or the injury is being caused in the brain, not in the heart. But the risk factors and the controllable risk factors are similar. So when we look at stroke and we look at the cause of a stroke, it is similar to heart attacks in that it is an obstruction in a blood vessel causing damage to the brain, except for when strokes are caused from bleeding in the brain, which can be caused from a bleb or some rupture of a vessel in the brain and causes the stroke that way. That's primarily why we're not going to treat strokes the same way as we treat a heart attack. We don't give anything by mouth. We're not going to give them an aspirin when it has to deal with strokes. Now, how do we recognize that it's a stroke? Strokes are classically going to show symptoms of one-sided weakness or paralysis completely. Their face on that same affected side tends to droop because they can't control the muscles in that side of the face. Their eye may not blink with the other eye. They may not be able to swallow, and saliva might actually kind of drool from one side of the mouth. Lighter forms of the symptoms, they may stumble a lot. They may have slurred speech. They may not be able to speak at all, or they may not make sense when they speak. But one thing to remember when treating a stroke patient is that in many cases they understand us perfectly. So we would be doing them a horrible disservice by talking to them as if they can't understand what's going on or that they can't understand us, when the whole time they really can. They simply can't articulate it back to us. So when we talk about strokes, regardless of what the cause is, the treatment is always going to be the same. Recognize the stroke symptoms, then activate the emergency medical services, watch the person who's having the stroke to see if they need to have us help control their airway, breathing, or circulation, and then make sure we get them to emergency medical services or to the hospital as fast as possible so that we can get them treated and hopefully begin the rehabilitation process so they can have a great quality of life again.